Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. Research finds semaglutide's cardiovascular benefit effective even in impaired kidney function patients. The anti-obesity medication semaglutide may help to prevent heart attacks, strokes, and other major adverse cardiovascular events, as well as death in adults with overweight or obesity who don't have diabetes, whether or not they also have impaired kidney function, according to new research presented at this year's annual meeting of the European Association of the Study of Diabetes, Madrid. The results are based on pre-specified analysis of the Select trials, which found that adults with overweight or obesity but not diabetes taking semaglutide for more than 3 years had a 20% lower risk of major adverse cardiovascular events or death due to cardiovascular disease and lost an average of 9.4% of their body weight. This new analysis found a similar percentage reduction in cardiovascular disease with semaglutide in those with and without poor kidney function in Select. Because those with poor kidney function have higher background risk of cardiovascular disease, the absolute benefit is greatest in this group, explained lead author Professor Helen Colquhoun from the University of Edinburgh, UK. She added, "These findings have important clinical implications. People with impaired kidney function have increased risk of cardiovascular disease, and the results show that semaglutide is safe and effective in reducing this risk substantially." Between October 2018 and June 2023, 17,604 adults from 804 sites in 41 countries with overweight or obesity were enrolled in the Select trial and treated with semaglutide or placebo for an average of 40 months. They had previously experienced a heart attack, stroke, and had peripheral artery disease but did not have type 1 or type 2 diabetes when they joined the study. The researchers found that in participants with impaired kidney function, semaglutide was linked to a 31% reduction in major adverse cardiovascular events and a 33% lower risk of major adverse cardiovascular events or death from any cause. The researchers also found that in participants with normal levels of urine albumin to creatinine ratio, semaglutide was linked to a 20% reduction in MACE, as well as 21% reduced risk of MACE or all-cause mortality. Similarly, in participants with high level of urine albumin to creatinine ratio indicating kidney damage or disease, semaglutide was linked to a 20% reduction in MACE compared with placebo and a 19% lower risk of MACE or death from any cause. Among those with impaired kidney function, serious adverse events were reported in 37% of those allocated to semaglutide compared to 46% of those on placebo. The Select trial showed the benefits of semaglutide for adults with cardiovascular disease who were living with obesity or overweight but didn't have diabetes. This new analysis finds that within this group, people with impaired kidney function had much higher rates of cardiovascular disease, said Professor Colquhoun. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.